This is what happens after you go to sleep for surgery. The anesthesiologist will administer a medication to make you fall asleep and also administer a paralytic medication to make sure that you don't move at all. They will then use this device over here called a laryngoscope. They will use it to open up the throat and then visualize the vocal cords. And that's actually what you're seeing right there. Those are the vocal cords, and the space in between is the airway called the trachea. And the idea is to place the breathing tube in between the vocal folds so that it enters the trachea. Once the breathing tube is in, they will then inflate a cuff that will seal the airway. The tube is then connected to a circuit that is attached to a ventilator. And the ventilator is the breathing machine that will breathe for you while you're asleep during surgery. And during the surgery, the anesthesiologists have to monitor every single vital sign to make sure that everything is within normal limits. If your blood pressure gets too low, they can give you medication to increase it. If the blood pressure gets too high, they can give you medications to reduce it. They monitor your oxygen levels to make sure that you're ventilating properly. They basically keep you alive during the entire surgery. And it all starts by the intubation process where the breathing tube goes in the airway.